So this is where we really take the research that you all have been doing to the next level and begin to really shape it and make it actionable for the next phases of the process, which are brainstorming, which is fun, and filtering what the brainstorming output is, and then repeating. It's really, the key requirements that your stakeholders for your need area are going to require in order to adopt your solution, plain and simple. And we like to think of it as quite literally those highest priority things that they care about that you can imagine framing in a way that you can measure objectively. So that's kind of the exercise. It really boils down to must-haves and nice-to-haves. And it can be tricky, just like the need statements, to get it right. And you'll treat it like a prototype. You'll put need criteria down, you'll revisit them, you'll rehash them. You may end up with need criteria that are too restrictive. Then you get into brainstorming and your brainstorming is constrained and it feels terrible. And then you go back and revisit. Do you have the right criteria? Have you validated them with the stakeholders? So it's starting to really, put some real world meat around the research that you're doing, obviously gathered by the interviews that you're doing. And again, it really defines the practical considerations and the constraints that you need to be thinking about when you go into the brainstorming space, room, wherever it is that you're doing your ideation. Okay, who's heard of engineering requirements? All the engineers, raise your hand. From the reading, anyone tell me the difference between need criteria and engineering requirements? Yep, exactly, right? And engineering requirements have to do with specific bounds that your technical solution has to hit, whereas need criteria have to do with other things, right? Stakeholders, what they care about, cost, efficacy, all those things. Good. So 4 buckets, and these were, I think, really nicely laid out in the reading. Some of them are really, easier to deal with than others. I think efficacy is often what we first go to, and that's often the starting point for you guys because it comes straight from the outcome that your need statement has already has within it, and it often takes the shape of the clinical trial endpoints in the study that you will do to prove that your device is going to work. So that's an obvious one. Some less obvious ones, but also very relevant and equally important, time to achieve a desired outcome. So this would be things like length of stay, for instance, in the ICU. Could you shorten that? Length of stay in the hospital. Could you shorten that? Amount of time to get to something that's meaningful. Or if you're working on something like a diagnostic, it could be the technical parameters of the diagnostic, the sensitivity, the specificity, the receiver operating curve, and what those metrics need to be. So cost is a tricky one because no one can tell you the number, and it requires some guesswork. It requires, I think, a lot of careful thought, a lot of discussion, again, iteration. And we like to think of it as the threshold above which your solution cannot cross to be acceptable to the market or the stakeholders. Or you can also frame it as a reduction in cost related to the current treatment, whatever that may be, or current treatments. And so the buckets start to talk to each other a little bit, because if you've got a solution that has equal efficacy to the current standard of care, your cost better be higher, same, lower, right? Lower, because it's going to require switching and change in practice and maybe workflow. If you've got something with huge efficacy that blows the doors off what's being done now, maybe you can charge the same price, maybe you can charge more, right? Getting back to what Jay was telling us last week about value. And if you're creating a lot of value, you should be able to, price it in such a way that rewards that value. Safety, that tends to be a little bit more of an obvious one to think about. Adverse events, complications, either mortality or morbidity related to a treatment in this case, for example. And oftentimes it gets framed as, framed in relationship to something else. So you've got a need area, this is the current standard, this is the mortality associated with the treatment, this is the morbidity. How much of an improvement do you believe you'd need to make in order to satisfy the stakeholders? Usability was always my least favorite, and I'll get your thoughts here, Josh, because it's a little squirrely, right? And you can talk about things like, operator productivity, right? Does it decrease time? Does it make it easier for the operator for a treatment to perform the operation or procedure, whatever it is? Can you enable a less skilled provider to successfully perform whatever it is? Can you change the venue for the procedure? Can you move it from a high cost setting to a lower cost setting, OR, hospital OR to surgery center? Can you move it from the surgery center to the clinic? Can you move it from the clinic to some other decentralized area of care? Don't know if you'd add.
So you don't have to have need criteria in every one of these buckets. You could have a subset. Some are more appropriate than others. And I agree with you, Zach. The where usability, you have to be very, very careful, because what's the usability of a biopharmaceutical, right? And so it starts to be like, if you start adding some criteria there, you might be already leading the witness to a particular solution that you have in mind. So you need to be a little careful about that. Now, sometimes it's completely appropriate because the domain of the need is really focused on, how do you make a scalpel sharper, so, I mean, usability is going to be in there, right? But if it's really, really broad, then you want to make sure that you're not creating category, criteria under these buckets that are really leading you towards a solution you have in mind already. So you just want to watch that. But I agree. But you don't need all of them. It's just typically where you might go to start brainstorming. But you will find other things that for example, I always have patient experience. When I'm thinking about the experience of getting therapy, it's not really efficacy, right? I mean, they could still have an outstanding result, be cured of their cancer, and have a lousy experience, right? So, and a lot of the companies that I've started, the patient experience was actually one of the lead things that we were trying to go for. We wanted to create a good outcome, maybe as good of what they're getting with another modality, but have the experience be better.
Yeah.
And that's transformative for the idea, because you would much rather choose having a procedure that you have a better experience.
No, I think that's super well said. And, I could see that working into cost, right? Not just financial cost of the device, but what's the cost to the patient for getting the treatment, right? So we talked through a lot of this. I mean, I think the general rule of thumb is 3 to 5 in each bucket. So the must-haves are clear go, no go criteria. Any solution you develop has to meet all of those in order to move forward. The nice to haves are just that, nice to have. Maybe they would be a differentiator in the marketplace. Maybe they would make your solution more attractive to a certain subset of the stakeholders. Maybe not all the stakeholders care about it, but some of them do. But the left side there really has to be achieved in order to move forward. So again, good starting point is the outcome in your need statement, right? That gets you talking about efficacy as a first place to start. I don't know, Josh, if you might have any advice on quantifying some of these things, especially around cost, because we always found that was always the most difficult. Like, what number do you use and how do you get there?
Yeah, I think that when you have a clear competitive alternative and there's a cost associated with it, that's a great benchmark. You're looking for these benchmarks out in the universe of that space that are clear. That's great. Quite often, you're inventing something that has never existed before, and therefore the rudimentary tools or rudimentary approaches that exist, they might be ridiculously inexpensive, but they're also not achieving a really good outcome. And then you have to look elsewhere. Sometimes certain procedures have an existing payment framework that exists, a DRG in some cases, diagnostic code, or a CPT code. And these codes have associated payment values to them, which can be looked up online. Often if you budget out like what's being paid for, you can see that there's a ceiling on the total price for that procedure. And if you're swapping out something, you can remove that cost, and then you can imagine how you might fill the gap. When we came up with pricing for balloon sinuplasty for Clarence, balloons had never existed before. The alternative was a $200 shaver blade, which obviously wouldn't have been a very attractive market. But when we took the entire, coding value of what was being paid for the procedure, we realized that there's actually a fair amount of profit in there. And so we split the difference with the provider. Basically, we took a piece of that profit, still allowed them to get their profit, but we took out the shaver, took out some of the other equipment, put in the balloon, and that gave us a price of about $1,200. So that was the price that we came up with for balloon sinuplasty. But the big picture is you have to use these proxies to come up with what your available price is. And if you think you are improving outcomes, then you start trying to value those outcomes, and you're going to get talks on value and economics. And the value of extra life years is very significant, and there are accepted things called qualities for how you come up with an assessment of what that is worth. You can't always get the full value of the quality, but it is a way to value sort of your innovation if you're able to achieve the outcome. So it wouldn't be limited to existing payment frameworks or competitive. It's a good benchmark if you think you're going to achieve similar outcomes, but there are other ways to go to create that value threshold if you're actually improving quality of life substantially.
Yeah, well said. So again, beating a dead horse here, but if any of your must-haves are not met, the solution can't go forward. Now, if you end up with nothing moving forward, then it's time to go back and look at the need criteria. Back to your stakeholders. Is this really what the stakeholders require?